Welcome back to InStyleAtlanta.com. I'm your host Skye, and today I am sitting with the fabulous Dr. Jimerson, also known as Dr. J. Curves, plastic surgeon. Welcome.
Well, thank you for coming.
Yeah, so plastic surgeon.
Yes. Yeah, I mean, that's what we do. We make women look good, men look good, and I like giving people curves. That's what I'm known for.
Dr. J. Curves is the best Brazilian butt lift doctor in the South, honey. Everybody go to this man. I got to get it going on, boo.
I'm gonna, clean up this whole area for you, get this nice and flat for you. Okay, I want to get you some nice curves right here.
I have never had a man touch me so soon. he's spilling all over me. Yeah.
I grew up in a medical family. So my dad was a doctor, my mom was a nurse practitioner, so I just kind of grew up around medicine. And so I knew at an early age I wanted to take care of people. My dad is an internist, so I thought I was going to be an internist. And so when I went to medical school, that was really kind of what I had in mind. I didn't really know any surgeons, and I certainly didn't know any plastic surgeons. However, when I was in medical school, I fell in love with surgery. But general surgery even though I love surgery, it wasn't complete for me. I still wanted to do some of the diagnostics, so I actually was going to do OBGYN. And then one summer, between my third and fourth year, some plastic surgeons from the community came in, and they showed these pictures, and they talked about their experience with Operation Smile, which is it's an outreach program where plastic surgeons go to other countries and they do cleft lip palate repair. And I mean, it blew me away, and I was like, wow, this is me. And so that's when I started pursuing plastic surgery.
So what was your first patient? What was that like? Were you nervous?
Yes,
Were you like,
of
oh my
course.
gosh, I've never done this. Oh gosh, I hope I don't mess up.
It wasn't, you know what, you're nervous, yes. But, I had one employee, it was just me and her, we were both answering the phone, I had my cell phone, it's kind of crazy actually. But actually before I finished residency, I went ahead and got a number, started a website, so I already had appointments before I got here. And then, so my first patient, I was nervous, I was like, oh my goodness. But when you get in the room, it's just like, boom, it just clicks. And it's like, our training is so long and so comprehensive that really, if you're trained well and you know what you're doing. And so you just go in there and all the anxiety's gone and you just do your work. And same thing with surgery, so that's how it works.
How are you doing?
How did she do?
She did excellent. We got all the fat off your belly and your sides. We made your butt nice and round. And so everything went well. Remember, no dancing, no jumping around on stage. If you want to sing, just right at the mic, okay?
Now I know you've worked on a couple of celebrities, Lily from SWV, and Shekinah, who's Tiny's BFF. So what was that like? So working on those celebrities, did that take you to another level?
I would say it brought a little more light to the situation. So, we have been plugging along and doing, my goal is always to do an excellent job. I don't care who I'm operating on. When people are in front of me, it's going to be 120%. So that's the way I've always approached it, and so I think, we were actually really getting pretty popular. We couldn't answer the phones before because it was just too many, inquiries and so forth. And I think it was because of our pictures and our work, And then after we did the celebrities, then millions of people got to see, they got curious and went to look, and then they're like, wow, you can get this done.
Right.
You know what I mean? And so it really increased dramatically.
So what are some of the services that you guys provide here?
So I'm a plastic surgeon, but I focus on cosmetic surgery. So plastic surgeons can focus on different things: hand surgery, Craniofacial, like facial trauma, that's maxillofacial, and then cosmetic surgery is another one. So I focus on cosmetic surgery. So everything, facelifts, I've done tons of facelifts. You know, eyelid surgery, breast, tummy tucks, liposuction, fat grafting, but you name it, you know, I can probably get it done. And also, I'm sort of creative too. So sometimes, you know, because as plastic surgeons we get unique problems. You know, it's not just the routine. You know, we're taught a concept, and then we're able to expand on that. So if someone comes in with something kind of a little bit off the beaten path, then we can come up with something for them sometimes. You know, we've had patients who have had the silicone injected into their butt and it got infected. This is the illegal silicone stuff. And, you know, and so they ended up having their entire butt removed, except for the skin. You know, and I've had to recreate their butt.
So you mentioned, you know, illegal injections, because there are other things that are out there. People are injecting Fix-A-Flat, and, you know, how do you know who's legit and who isn't?
Well, okay, so the people that are injecting Fix-A-Flat and these illegal they're not doctors. So you'll know pretty immediately, because, you know, you'll only be able to hear about it because your friend knows, and they're in a motel, you know, at a certain time, a certain day. I mean, they're not doctors. So if you go to a doctor's office, you know, and then the other thing is, it's not just going to a doctor's office. There are a lot of doctors that call themselves cosmetic surgeons. And the public really doesn't know the difference, because plastic surgeons are cosmetic surgeons, but cosmetic surgeons are not necessarily plastic surgeons. It could be all kinds of doctors. It could be internal medicine doctors, it could be ER doctors, it could be, you know, whatever. And people don't really know, because they have a board called, you know, the Board of Cosmetic Surgery, which is nothing equivalent to the Board of Plastic Surgery. So it's confusing for the public, and I think you know, if someone wanted to know who to go to, they could go to the American Board of Plastic Surgery's website, and they could see if their doctor was certified by the American Board of Plastic Surgery.
I guess. So what is the fat grafting?
Fat grafting is where I take fat, okay, from different parts of your body that we don't want it, okay, like your tummy, your love handles, your lower back, you know, sometimes your inner thigh, and then I put it in areas where you want it, like your butt, you know, and so it can enhance your butt, or I put it in your breast to enhance your breast. Or some people, they get the veins in it, so you can put it in their hands. You can put it in their face, you know, to make the face not so sunken in. You know, a lot of older people have atrophy of the fat in their face, and so they need fat in their face or around the eyes. So fat is a very, very good filler, and it's natural to the body, it's innate. And so that's what we. So I'm a fat. So I specialize in fat grafting. It doesn't really matter where I put it.
So is that something that a lot of people do, fat grafting? Or?
Fat grafting is a very new part of plastic surgery. It's an area that I focus on because I love it. I call fat liquid gold.
I don't know. Maybe
and
some people
I
might.
hate throwing fat out. You know, when I see it, I'm like, do you know what I could do with it?
Oh.
You know? But no, I think fat grafting is the future of plastic surgery. That's my personal opinion. And it's going to become even more relevant in medicine in general, because there's a lot of stem cells in fat, and these stem cells may prove to be beneficial in curing a lot of diseases.
Right. So you take the fat from, say, my thighs, and you put it in you know, either breast, booty. How long will that last, or, you know, what happens? Because if you work out, you know, your fat kind of goes away. So if you work out, will your booty go away, or how? Okay, so here's how. So fat graft is like any other graft. So let's say you were burned. The plastic surgeons are burn doctors. So say you had a burn on your leg,
and we have to take the skin off your leg. We take the skin from somewhere else and put it here to cover. That skin is not going to go away. It's going to stay there for life. Now the whole thing might not survive. Maybe 80% of it survives. Maybe 70%, maybe 100% survives. But that skin will now be there. That's its permanent home. Same thing with fat. So we take the fat from another place in your body and then we put it somewhere else. Some of it will not survive. So we usually quote a number of about 20% not surviving. But to be realistic, I don't think know exactly, because I think the survival rate is different in different parts of the body. The survival rate depends on the blood supply. Okay, so how much blood is in that part of the body. Once the fat is connected to a blood supply, it's there permanently. Now, what happens when you exercise? When you exercise, all your fat cells shrink, but the fat cells are still there. You have to understand that fat grafting in the butt is popular, but that's not what people are coming for. People are coming for a look. That's what they want. And the fat grafting in the butt is only part of the look. But people are flying from England and Germany and Africa and everywhere. Dubai, it doesn't matter. All races, all cultures are flying here to Atlanta for a look. They want to look a certain way. So, a lot of people, they want to just isolate the butt, but I'm going to be honest with you, if I just focused on the butt and everything else was messed up, it would not look good. So you really have to know what that look is, and then you have to give them that look.
Okay, so this here is an actual butt implant?
Yes.
You stick...
That's a sizer.
Okay.
But it looks just like this. This is the actual material. So this would come, obviously sterile. But yeah, so basically this is, people come in and you size them up, make sure that it's the right size for them. And then on the day of surgery, slip it in.
So you cut them?
Yeah, so we make an incision in there, basically in the crack, on either side. We dissect out of the muscle, and then we open the muscle up, put it in, and close the muscle.
Oh, wow. Now you also do breast enhancements?
Yes.
So is that silicone based or what?
So with the breast, we do 3 different things. And well, when we're talking about, I guess we do multiple different things, talking about enhancement. But for breast enlargement, we can do either saline or silicone implants, or we can do fat grafting. Now they give different looks. If you want me to put fat in your breast, it's going to be a natural look. So you're going to have larger breasts, but they're going to be natural, as opposed to an implant look where there's more fullness at the top. A lot of times, I like doing an implant with fat grafting, especially in thin women who don't have a lot of fat, because then I can camouflage the implant. So I like to think of the implant to give you projection, okay? But it can't really, shape. So fat is the shape. So if I need to, give you more cleavage, sometimes people can't get cleavage because their muscles are so far apart that you can't push that implant over. But then you can put fat there and give them some cleavage. So they kind of work hand in hand to give you the best result.